The culture of microorganisms from blood is critical in the laboratory diagnosis of bloodstream infections in order to manage patients with many infective conditions associated with the clinical presentation of pyrexia. Blood culture plays an integral role in the evaluation of sepsis, and it is therefore essential that the blood culture procedure is carried out in a timely manner using an aseptic non-touch technique to avoid contamination of the specimen. Microorganisms are present on the skin surface of patients, staff, and the immediate patient environment, and can easily contaminate specimens. Coagulase negative staphylococci are the commonest blood culture skin contaminant, and therefore proper cleaning of the skin is a vital component of venesection and aids in the prevention of false positive results. These results can cause confusion due to the difficulty in determining if a positive blood culture is due to a genuine pathogen or due to contamination of the specimen. Contaminated blood cultures may compromise patient care by prolonging their hospital stay and exposing them to unnecessary antibiotic therapy. It also leads to needless engagement of clinicians, nursing staff, medical laboratory scientists, and unnecessary repeated blood cultures. Although it has been recommended that the target rates for blood culture contamination should not exceed 3%, the contamination rate for many institutions may be much higher than this. A study carried out in Antrim from 2007 to 2008 found that 4.7% of blood cultures were contaminated, and that false positive results added 1,372 hospital days and incurred detrimental additional hospital costs of £1.3 million per year. Collect and fill out the microbiology form. It is important to ensure you complete the forms fully and that the patient history is relevant. This must include recent or current antibiotic use, as this information aids the interpretation of the blood culture by the microbiologist. Decontaminate hands. Clean the tray according to your local policy. Collect the blood culture pack. Each of these will contain 2 sterile drapes, one for the sterile field and one for under the patient's arm, 2 blood culture bottles, a green aerobic and an orange anaerobic bottle for adults, an adapter cap, a set of sterile gloves, a 23 gauge butterfly, a sterile gauze, a tourniquet, 1 adhesive dressing, 2 chlorhexidine alcohol wipes, and a chlorhexidine alcohol applicator to decontaminate the patient's skin. For pediatric patients, 1 yellow blood culture bottle is required. Ensure positive patient identification, explain the procedure, and ensure consent is obtained. Inspect the site that you intend to use for venipuncture, ensure that it is visibly clean and washed with soap and water if in doubt. Remove contents of the blood culture pack and place on the trolley. Check bottles are in date. Discard if the yellow spot is visible. Check fluid levels and mark 10 milliliter level on each bottle. Decontaminate hands. Open sterile drape. Decant equipment onto sterile field. Check expiry dates. Using aseptic non-touch technique, i.e. without touching the key parts, assemble the winged butterfly infusion set to the blood culture adapter cap. Put the sterile drape under the patient's arm. Apply the tourniquet and palpate the vein. Decontaminate hands. Open the chlorhexidine alcohol applicator by squeezing the handle to click and activate. Wipe north-south and east-west for 30 seconds. Do not wipe in a circular motion. Allow to dry for up to 60 seconds. Remove the plastic caps from the bottles. Effectively clean each one with a separate chlorhexidine alcohol wipe for 15 seconds and allow to dry. Tighten the tourniquet. Decontaminate hands. Open and apply sterile gloves. Unsheath the butterfly needle. Insert needle bevel up. Check for flashback. Secure one wing of the butterfly in a north-south direction with sterile tape. Using the aerobic bottle first, green top, hold bottle upright below the level of the arm and connect the adapter cap. Pierce the septum to fill with 10 milliliters of blood. The more blood, the better chance there is of identifying the causative organisms. Smaller volumes, such as less than 5 milliliters, significantly reduce the chance of bacterial growth. 4 milliliters of blood is required for pediatric blood culture bottles. Repeat the process with the anaerobic bottle, orange-topped bottle. Use monovet collection tubes if further bloods are required. Release the tourniquet. Release the tape. Place sterile gauze swab across insertion site. Remove the butterfly needle and engage the safety feature. Safely dispose of sharps. Remove the gloves, decontaminate hands and apply clean gloves. Correctly label the blood culture bottles. Handwrite the patient's details on the bottles, ensuring that the barcode label is not removed or covered. Ensure the patient is comfortable. Confirm hemostasis. Safely dispose of equipment. Remove gloves. Samples now need to be sent immediately to the laboratory to facilitate early detection of bacterial growth and avoid false negative results.